医生就出来跟我宣布，我父亲死亡了，有一种特别愤怒的感觉。很多人丢掉了宝贵的生命，为什么这样？是谁导致这个人间的这个大灾难的？
Stay calm. The virus is crazy. We don't want to be crazy. Calm down.
I have no doubt that the scientists and doctors who are on the front lines knew exactly what they were dealing with.
The person sent a red light flash to the boss of the company, and the boss says, "This is serious."
It seemed absolutely ridiculous that we couldn't release the data.
Viral pneumonia has hit central China's Wuhan city.
The impression that the rest of the world got was just what the Chinese authorities wanted, which is that everything was under control, which of course it wasn't.
It was always going to be very difficult to control this virus from day one. But that was the shot we had, and we lost it.
First case here of a severe flu-like illness, which experts say is a worldwide threat to health.
Pneumonia-type bug first appeared in Guangdong province. Officials there saying the outbreak is under control.
World Health Organization has identified the virus behind a severe outbreak of pneumonia.
The story does start with SARS, and it began with the lack of transparency from China.
In November 2002, an outbreak of severe acute respiratory syndrome, or SARS, began in southern China. The virus is thought to have passed from a bat into a civet cat and into humans at a market. It then spread quickly through southern China's crowded factory cities.
Doctors identified that something unusual happening, reported it to the local public health authorities. It took weeks and months, for them to take decisive action.
China's authoritarian government maintained everything was under control.
The immediate response of the Chinese government was literally to lie and dissemble. And that caused total confusion for the rest of the world as this epidemic began to ignite.
5 months into the outbreak, a Beijing doctor exposed what was really going on. He revealed there were many more cases than the government was letting on. The central government in Beijing now admitted the scope of the problem.
SARS has come to North America.
1,000 people have been quarantined in Hong Kong.
2 dead in Canada and 6 cases in Europe.
By this time, SARS had spread around the world and would cause almost 800 deaths. In China, news of the cover-up caused outrage.
Chinese people became very concerned, but also angry that the government is not telling them the truth.
There were stories of kind of people rising up and mistrusting information. damage to reputation of the party states domestically and internationally was very heavy. It was felt.
SARS was deadly, but not highly transmissible for the general population. Within 8 months, the outbreak was contained.
It was widely seen that the delay by China in reporting and actually responding was absolutely the reason why we weren't able to nip it in the bud. And so the narrative in the global health world was China did learn a lesson. They would be better next time, and that they would be much more responsive and transparent.
Beijing set about making sure that SARS could not happen again. The following year, it began creating what it claimed was the largest online infectious diseases reporting system in the world. Run from a new Center for Disease Control, China's CDC.
I helped them develop the national CDC. The CDC that I first visited was in disrepair. That's completely changed. And what they did was they created these various programs. It was 100 talents, 1,000 talents, so that people who had been trained in other parts of the world were recruited back to China to contribute to the establishment of new infrastructure for infectious disease surveillance.
One of those recruits was George Gao, a virologist at Oxford University. He became the head of the China CDC in 2017.
Let me tell you how we organize the disease control and public health in China. Surveillance. We have the general centralized data center. It's in China CDC. I will know within hours whether or not we have an outbreak, even in a small village.
By 2019, Gao was promising that the country's new online surveillance system would be able to prevent another outbreak like SARS.
So they were indeed confident, right, that they had the capacity to handle well a major disease outbreak. Should it happen, right, that they would be able to nip the crisis in the bud.
On the 1st of December 2019, a man in his 70s fell ill. He was admitted to a hospital in Wuhan, a vast industrial city and the transport hub of central China. Unbeknownst to anyone at the time, by December the 11th, up to 200 people were likely infected with the coronavirus. Most were carrying on their normal lives, with very mild symptoms, or none at all. Many of the cases would be traced to a sprawling live animal market, which supplied the city's restaurants and food shops.
Colleagues at the Wuhan CDC, the Wuhan Center for Disease Control, 2014, took me there really to say, look at this place. This is the kind of place where emerging microbes may appear. And I took lots of photographs because they are quite jarring. There were snakes, cats, raccoon dog, and they were sometimes in individual cages on the floor and sometimes stacked on top of each other.
It's not known whether the market was where the virus first made the leap from animals to humans. But by mid-December, several people were turning up at nearby hospitals. Doctors noticed a pattern: strange white spots in patients' lung scans.
Doctors put 2 and 2 together, that if you're in a hospital and you see one pneumonia patient, or even 2, you may not think anything untoward's happening. But the fact that they were seeing in different locations meant that that cluster meant there was an infectious agent going around.
Three weeks after the first illnesses emerged, doctors at Wuhan Central Hospital took a sample from a patient's lungs. They sent it to Vision Medicals, a private company 500 miles away. Within 48 hours, the company had come up with a short genetic sequence of the virus. A technician at the lab later posted an online account of what happened next. Virologist Wang Linfa read the post before it was deleted from the internet.
The report back on December 26 is to say, oh my God, these patients' samples contain genetic sequence most related to bat coronavirus.
The technician then contacted his boss privately over the messaging app WeChat. Coronaviruses are a large family of viruses, which includes SARS and the common cold. The sequence from Wuhan hadn't been seen before, but it was strikingly similar to SARS.
The person who operated that machine and did the analysis basically sent a red light flash to the boss of the company. And the boss says, this is serious. Don't send the report out until you're 100% sure. And a few hours later, basically says, I'm 100% sure. This is real.
The lab informed doctors at the hospital and the Wuhan CDC. They also sent the sequence results to the state-run Chinese Academy of Medical Sciences in Beijing. By the 30th of December, word of a new SARS-like virus had started to spread among officials in Wuhan and Beijing. Several more samples were sent to state labs for sequencing. The genetic sequences weren't shared with the international community.
So the sequence of a pathogen is really important because that is what allows people to figure out how quickly the pathogen is spreading and to be able to create tests to detect the virus is really crucial information for health authorities in other countries to start detecting this virus. You know, where is it going? Is it going to go outside of China? Is it going to become a pandemic? Is it human-to-human transmissible? Of course, you don't want to rush out some information that could potentially be false and, you know, make everyone think that, oh, this is some other kind of pathogen and somehow misinform people.
A month after the first cases emerged, hospitals in Wuhan were receiving dozens of patients with severe pneumonia. Wuhan's 11 million people were still going about their lives as normal, spreading the virus around the city and to the rest of China. A Beijing-based lab, Capital Biotech, then sent Wuhan Central Hospital the startling results from a sample they'd analysed. This lab had obtained a different result from the previous one. Rather than a virus similar to SARS, they said it was SARS itself. It would turn out the lab had made a mistake, but the results quickly started circulating among doctors at Wuhan Central Hospital.
This was the first time that the information about the possibility of this virus was shared. This was the first time there was documentation, there was evidence that something is really happening, and that's being shared publicly. WeChat groups are like little discussion circles. It could be hundreds of people in one group. And it's very, very easy for information to spread, and it spreads like fire.
At around 5:30 p.m, it reached Li Wenliang, an eye doctor. He forwarded it on with a warning. Don't circulate this information outside the group. Tell your family and loved ones to take precautions. His message went viral. Within 24 hours, millions of people across China were talking online about SARS. In Wuhan, the local health commission ordered the city's hospitals to report any new cases directly to them, and barred them from releasing information to the public. Within 12 minutes, the orders were leaked online. They too went viral. News of an outbreak had escaped.
I guess you could say it's the most wonderful and busiest time of year. A lot of people, high volume, are going to be traveling.
That night, the rumours reached Marjorie Pollock, an epidemiologist with ProMed, an organisation which sends out alerts on disease outbreaks.
I checked my email after dinner, and I had an email from a colleague in Taiwan. Social media was ripe with lots of chatter going on in Chinese of an outbreak, and did we know anything about it? I was able to monitor the Weibo posts, and it was just going wild. My reaction was, we're in trouble. It was very much a deja vu of what happened with SARS-1. So put together a report to go out as what we would call an emergency post, getting it out as soon as possible.
It went out to around 80,000 subscribers worldwide.
It's already the new year in much of the world, and here in New York, they're getting ready for the most famous New Year's spectacle, the ball drop in Times Square. NBC's Stephanie Goss.
Peter Daszak, head of a New York-based infectious disease research organisation, contacted Marjorie Pollock with more news.
I got hold of her on New Year's Eve, and as the champagne was getting warm, we realised something really serious was going on in China. We had it from a good source that this was a coronavirus and that it was 20% different to SARS. So we knew that SARS was pretty good at transmitting from person to person. We knew it had a 10% mortality rate. That's a huge red flag. And really knew something was wrong when every single senior person that I was trying to get hold of in China was busy. I sent a really long text to George Gow's, head of the CDC. I offered to send a team out there to come out there and do anything to support him. And I got the shortest response ever from George, which was, Happy New Year.
But George Gao did contact virologist Ian Lipkin with information. This is the first time Lipkin has recounted details of their conversation.
I was in a restaurant waiting to ring in the new year, and I got a call on WeChat, and it was George Gao. He'd identified the virus, it was a new coronavirus, and that it was not highly transmissible. Well, this didn't really resonate with me because I'd heard about many, many people who'd been infected. I think he was just wrong. You know, I don't think he was duplicitous. I think he was just wrong. He should have released some sequences and said, this is what we know. These are the sequences we have. My view is that you get it out. That's the way we do it, because this is too important to hesitate.
News of the possible outbreak, the return of SARS, had actually spread far beyond Wuhan by late December. And that suddenly there was this increasing kind of pressure because the outside world was looking. But that's a dual-edged sword in China, because on the one hand, the outside world looking can create pressure to act. The outside world looking can also create pressure to cover up.
Viral pneumonia has hit central China's Wuhan city. Authorities have reported 27 cases in total, 7 of which are critical.
The National Health Commission now ordered Wuhan officials to announce the outbreak. The news was aired on state-run TV.
Patients are reported to have worked at a local seafood market.
But the officials played it down, describing it only as a viral pneumonia.
因为我们肯定会，我们排查了嘛，排查了目前是跟非典没有关系，别的病原体正在排查。
They reassured the public that there was no evidence of human-to-human transmission and closed the market in which they maintained many cases originated.
The first instinct of the authorities is always to cover up. One of the key values of the Chinese Communist Party for the last 40-odd years has been stability. The avoidance of what they see as chaos, the dangers of revolution, overthrow. But the party is also very concerned about the idea that whole populations might freak out. And that might result in mass shortages or people being crushed to death trying to flee somewhere. That urge to control, that belief that the public can't be trusted, is also very kind of ingrained.
Definition of stability keeps getting escalated as the ability of the Chinese government to monitor absolutely everything improves. Even some of the thoughts and speeches of Chinese citizens, they are now seen as signs of instability. Increasingly, even in WeChat, which is a private platform, that kind of so-called deviant speech would be punished with administrative detention or suspension of accounts.
On January the 1st, the Wuhan police dealt with the doctors who'd spread the news of an outbreak. On state TV, they were labelled rumour mongers and internet users. Several were given official reprimands by the police. The news was widely covered on national television. The eye doctor, Li Wenliang, whose post had gone viral, was among those to sign a confession. The clampdown extended beyond doctors. Chinese journalists were now subject to specific censorship instructions, and key words began to disappear from the internet.
When I first started seeing the reports on December 31st, doctors from inside were describing it as SARS. And so, I started searching Wuhan SARS to see what the discussion was online. And I couldn't find anything. That relevant search terms blocked, which is not a surprise because the government obviously wants to keep things stable. I'm pretty sure they did not want any comparison to SARS. They wouldn't want a panic to ensue because of that.
But in Beijing and Wuhan, top government officials were now confronting evidence that they were dealing with something potentially serious, a novel coronavirus.
So let me tell you what international law requires. If the government knows about a novel infection that meets the criteria within the international health regulations, and a novel coronavirus, by definition, meets those criteria of a potential public health emergency of international concern, the government is obliged by law to report that to the World Health Organization within 24 hours. So it was reportable. The failure to report clearly was a violation of the international health regulations.
The World Health Organization first learned about the outbreak not from the Chinese government, but from social media and the ProMed post. On January the 1st, its incident management team began a series of conference calls.
I remember sitting on the floor in the living room of my sister's house at 3 o'clock in the morning on those calls with the aim of, really understanding the situation. We had the assumption initially that this may be something new, that it may be a new coronavirus. And as a respiratory pathogen, for us, it wasn't a matter of if, human-to-human transmission was happening. It was, what is the extent of it, and where is that happening?
WHO officials requested more information from China. It was 2 days before they heard back. But what the National Health Commission told them was vague. Only that there were 44 cases of viral pneumonia of unknown cause.
The country has an obligation to answer WHO's questions honestly, fully, and transparently. And I don't think that happened entirely. Once you report to WHO, it's open to the world. You start to get travel and trade restrictions placed upon you. And so I think China's view was that it wanted to handle this pretty much, and that it was going to, it didn't want outside interference.
The National Health Commission now had a team of scientists and officials on the ground in Wuhan, investigating the outbreak. Labs across the country were secretly racing to map the complete genetic sequence of the new virus. One lab was run by a renowned virologist in Shanghai, Professor Zhang Yongzhen.
Professor Zhang, he's a very friendly, passionate, extraordinarily hard-working scientist. I've been working with him since 2012, and we essentially used genomic technology to try to understand virus evolution and diversity. Just how many viruses are there? How big is the total universe of viruses, the virus sphere?
Leading virologists Zhang and Holmes were in the middle of a long-term project on respiratory diseases at Wuhan Central Hospital when the outbreak began. On the 2nd of January, lung samples from infected Wuhan patients were sent by high-speed train to Zhang's lab. At 2 a.m. on January the 5th, Zhang obtained the full genetic sequence of the virus.
I was driving to breakfast, and he called me on the car phone. His team had worked very hard, and so he was very proud, obviously, of the work they put in. On that very day, he was working to try and get information released as soon as possible, so the rest of the world could see what it was, and so that we could get diagnostics going.
It was important confirmation that the virus was very similar to SARS, and therefore likely transmissible between humans. That day, Zhang's office wrote to the National Health Commission advising preventative measures in public places. He wanted to make the sequence public right away, but couldn't.
There was an official memorandum that had gone through saying that we were not allowed to do this, and so he was put in quite a difficult position.
2 days earlier, the National Health Commission had sent out secret instructions to laboratories, forbidding them from publishing their results without authorization and requiring them to destroy or hand over their samples. The Health Commission's orders were later leaked. 4 other Chinese labs also obtained the full genetic sequence of the virus. They too were forced to sit on their findings.
That notice effectively silenced individual scientists and laboratories from talking about this outbreak, from revealing information about this virus, and potentially allowing word of it to leak out to the outside world and alarm people.
The Wuhan Health Commission continued to reassure the public that the outbreak was under control, and no clear evidence of human-to-human transmission. Doctors were now dealing with more and more people turning up sick in Wuhan's hospitals. Health workers have been forbidden from talking to the international media. But one has taken a risk to speak to us, so we are protecting the person's identity. This is the first time a health worker from Wuhan Central Hospital has talked to international journalists about what was happening in those early days of the outbreak.
I began to suspect there was human-to-human transmission around the 5th or 7th January. There were so many people who had a fever. The respiratory department became full around the 9th or 10th January. I realized this thing had become big. It was out of control. Then we started to panic.
But on state television, a representative of the government team investigating the outbreak maintained it was a viral pneumonia.
现在我们看到的情况，总体来讲还是可控。那么大部分的病人还是相对来讲比较轻，而且有部分病人已经出院了。当然不排除个别的病人会比较重，因为每年的肺炎啊，实际上都会有非常严重的病人。
Everyone knew it was human-to-human transmission. Even a fool would know. So why say there is no human transmission? This made us very confused, and very angry. The hospital told us that we were not allowed to speak to anyone. They wouldn't even let us wear masks. They said they were afraid of causing panic among the patients. I thought the leaders were stupid.
Doctors and nurses began to get sick, a clear sign of human-to-human transmission. But when they tried to log cases and voice concerns with the local and provincial governments, nothing happened. One hospital leader even tried to warn the provincial leadership directly.
He was, trying to alert the provincial government leaders, that there's like a SARS type of outbreak in Wuhan, that you got to do something. But this provincial leader gave him a ring at night, say, is that really that serious, the situation? He said yes, but still, they choose not to pay attention to what he say. I think the main concern is that what if this is the false alarm, right? And if there's chaos, instability, people panic, then they would look bad in the eyes of the central leaders. That is not good for their personal careers.
On the 6th of January, city and provincial officials began 12 days of annual political meetings in Wuhan.
There are indications that Wuhan city officials did not want information about this outbreak to really spread because they really want things to go as smoothly as possible to make themselves look good. There's also could have been an order from the top down where they were saying, basically, get this under control, but don't tell anyone because we don't want to alarm anyone. It's very possible that there was kind of a systemic failure. It's a perfect storm of multiple failures happening at the same time in different parts of the government bureaucracy.
On the 7th of January, Xi Jinping issued his first instructions on the outbreak to senior officials. Though the contents have never been made public.
"怎么说呢？我和我父亲啊，都是武汉人嘛。我从小在武汉长大，我离开武汉是很早的，也去了很多地方。
Across China, most people were unaware of what was happening in Wuhan. Jiang Hai was making plans to take his 76-year-old father, Jiang Lifa, back to the city.
我父亲摔了一跤，医生是说要去院做手术。我开车嘛，带我父亲回武汉，因为我父亲他是享受公费医疗的。
Jiang Hai checked his father into the People's Liberation Army Hospital in central Wuhan to have his broken leg operated on.
就跟我父亲用的是全麻， 全麻后，我父亲是第3天才苏醒过来的。当时医生跟我说，我父亲手术是很成功的，同时恢复啊也是挺好的。当时我父亲的脸色是很圆润的啊。在医院的时候，我就是看医生嘛，他们也是戴着很普通的一个口罩，并没有什么别的防护那种措施。如果我知道武汉存在新冠疫情这个病情的话，我肯定是不会开车送我父亲回来。
9 days after they first heard about the outbreak, officials at the World Health Organization were waiting for more information. Publicly, the WHO had repeated China's official line that it was a viral pneumonia. But behind closed doors, they were frustrated at China's lack of transparency.
The WHO starts to get concerned because they're starting to hear, the Chinese authorities know more. Oh, they had sequenced the virus. They've identified what kind of virus it is, but they don't know what's going on. And that we know because the Associated Press obtained some recordings of internal meetings by WHO officials.
The AP shared some of the leaked recordings with the BBC.
We're going on very minimal information. I know it's clearly not enough for you to do a proper planning for it.
I think we need to see this here. I think we've all been on solos, been here before. It's got to be great. This is exactly the same scenario. In the lockdown in China. They did not, despite our good intent, if maybe especially if something happens, there will be a lot of finger pointing.
A really pivotal moment comes around January 8th when, they hear that the Wall Street Journal is about to report that Chinese authorities have identified a novel coronavirus. And this is information that the Chinese authorities have not told the WHO.
The WHO was now getting critical information from the media, not from the Chinese government. The emergency's chief, Mike Ryan, had a series of meetings with colleagues to discuss the mounting crisis.
Where China can make a huge contribution to the world right now is the immediate sharing of genetic sequences and primers with other countries. But unless they share that information and knowledge with others, it will probably not give them the best benefit. And it will certainly mean that other countries are going to have to reinvent the wheel over the coming days. There's been no evidence human transmission is not good enough. We need to see the data. We need to be able to determine for ourselves the geographic distribution, timeline, the epi curve, and all of that. It's absolutely important at this point.
Those concerns are not something they ever aired publicly. And instead, they basically deferred to China. They said, China says that there's this number of cases.
The next day, a WHO representative went on Chinese state television.
It appears that the cases have stopped, new cases have stopped after the market was temporarily closed. And we can see that there is no clear evidence of sustained human-to-human transmission.
Every day, we would go back and we would ask for more information, and we would receive information every day. Was it enough every single day? No, but I could say that for every country that we've dealt with, in every outbreak that we have dealt with. We have public discussion about the information that we have. We also have very direct conversations with countries privately, which are very strong in the sense of the information that we need. But we are at the United Nations Organization on Health, and we have a diplomacy that we use because this is really important that we work with all member states. We work with everyone, everywhere.
WHO was caught in a really difficult bind. It could have publicly challenged China, or, and this is what WHO decided that it would do, to actually work with China behind the scenes to try to coax them to cooperate. You know, time and time again, there have been countries that have violated the international health regulations, and director generals in succession really never called out a country.
Ultimately, the impression that the rest of the world got was just what the Chinese authorities wanted, which is that everything was under control, which of course it wasn't.
Five days had passed since Shanghai virologist Zhang Yongzhen had obtained the full genetic sequence of the virus. By now, Chinese state media had announced it was a novel coronavirus. But Zhang was still prohibited from publishing his data.
Once
the Chinese authorities confirmed it was a coronavirus, at that point, it seemed absolutely ridiculous that we couldn't release the data. It was untenable that we were sitting on this information and not letting it go out. It just seemed wrong. He was very stressed because he was under great pressure. He's a Chinese citizen, and he's a very proud Chinese citizen. He doesn't want to do things that he thinks will be wrong for his country. On the Australian morning of January 11th, Zhang and I were talking on telephone. He was on a plane flying between Beijing and Shanghai. I said that we need to release it. It's now or never. We have to do this. And he said, okay. So he sends me this email with a file of the sequence in. And I contact a colleague in Edinburgh, Professor Andrew Rambo, and he established a website called Virological, which is used for rapid dissemination of data. It's like 1 o'clock in the morning in the UK, and we need to write like some text saying what it is and where it comes from. My hands were I remember I was sort of shaking as I was pressing the button. I could almost hear the hands of the clock ticking. So then we posted it on Virological, and I put a tweet out saying, here's the first genome sequence. So that bit was done extremely quickly. I just felt the weight of pressure just to get this out there. The sequence release was a key moment because it told people, right, this is the pathogen, this is what it looks like, it's a real thing, here it is, and now we can start.
The release of the sequence forced Beijing's hand. The next day, state scientists released the 5 sequences they had obtained several days earlier. The international community was now able to act. On the 13th of January, German scientists published a toolkit for a test, so other countries could check for cases. Thai health authorities, who had detected a possible case 5 days earlier, could now confirm it.
Found outside of China.
A Chinese tourist in Thailand is the first confirmed case of the new pneumonia virus outside China.
By allowing the sequence to be published, Zhang had defied an official government order. The next day, his lab was temporarily suspended for rectification. In the official Chinese narrative of the fight against COVID, Zhang's name does not appear. "6 weeks into the outbreak, the government was still saying there was no clear evidence of human-to-human transmission. But Wuhan's hospitals were filling up.
Every day, there were several hundred people with fever arriving at our emergency department, hundreds every day. I was definitely afraid. I realized that this illness was everywhere.
Patients were starting to die.
Around me, one by one, my colleagues were becoming infected. All of us were definitely scared.
Although there were now thousands of sick patients across Wuhan, they weren't being logged as COVID cases. The official count remained at 41. Only local and provincial authorities were approved to confirm cases, and the criteria for including them in the outbreak tally were narrow.
At the level of the hospital, we could not confirm a diagnosis. And I don't know what level could actually confirm the diagnosis. So to say there were 41 confirmed cases, I don't think is incorrect. But if you are talking about suspected cases, I guess that at that time there were already hundreds and hundreds.
For the past 2 weeks, National Health Commission scientists had been investigating the spread of the virus.
At the very beginning of January, the central government had dispatched a team of leading infectious disease experts from the Peking University School of Medicine, it's kind of like the Harvard Medical School of China, as well as from other leading universities. And so they arrived in Wuhan, they began to look at the clinical data that they had gathered up to January 2nd.
The data covered all 41 official cases, all hospitalized by January the 2nd. It was an alarming picture. It turned out only 2/3 of cases were linked to the Huanan market. The first case had no link to any of the others. There were clusters of cases within families. They concluded the virus could have acquired the ability for efficient human-to-human transmission, and that there was potential for a pandemic.
They had been working on this paper since early January, and so they would have submitted an internal version of the paper to a senior official in China.
Then the authors sent the draft to the Lancet Medical Journal in London.
When I read through that paper, I had nothing but fear, because the severity of the disease was shocking. I mean, these patients, they were rapidly deteriorating into multi-organ failure, admission to intensive care unit, a high mortality. The virus was triggering this massive inflammatory explosion, which was damaging the organs of their bodies. And when you see the severity of the illness combined with the signal of the risk of a global pandemic, fear.
Horton says he received the paper between the 14th and 17th of January and did not publish until it had been peer-reviewed. In the meantime, Beijing did not make public its team's findings, including that the virus was likely being transmitted from human to human.
I think that what was happening was that very difficult interface between the message coming from the scientists and the politicians who are trying to manage that message internally for domestic security and externally in terms of its international relations. And I think that's where the block took place. But I have no doubt that the scientists and doctors who are on the front lines knew exactly what they were dealing with.
In Beijing, the government secretly started to ramp up its response. Xi Jinping issued new instructions on the outbreak. They were passed down to the country's local and provincial health departments by teleconference.
So the Associated Press's global investigative team obtained some documents. Shows that on January 14th, China's top health official, Ma Xiaowei, he told the country's public health institutions to prepare for a possible pandemic.
The documents contained warnings that the outbreak was likely to develop into a major public health event. China's most severe challenge since SARS.
They were saying things like, clustered cases means that human-to-human transmission is possible. They were saying things like, because of upcoming travel for China's biggest holiday of the year, the Spring Festival, means that this virus could be spreading widely.
They began monitoring people's temperatures at train stations and airports around Wuhan, and started preparing hospitals across the country. The government did not announce these new emergency measures to the public, but it did authorize state media to now say that limited human-to-human transmission could not be ruled out.
新型冠状病毒感染的肺炎疫情，今天凌晨，武汉发布最新消息。
现有调查结果表明，尚未发现明确的人传人证据，不能排除有限人传人的可能，但持续人传人的风险较低。
那么作为公众来讲呢，更重要的是做好我们个人的防护。那么去医院这些场所戴口罩，注意手的卫生，注意通风，那么减少我们到人群聚集的场所。
These documents reveal that central authorities were very alarmed about this virus by January 14th. But in public, again, they weren't really raising the alarm. They say things like, in the run-up to the two big meetings that China has every year, political meetings, we have to maintain social stability. There's a big emphasis on that. And that really points to the authorities not wanting to freak people out for political reasons.
The WHO called its first press conference on the outbreak.
So good morning, colleagues. Thank you for the opportunity to be here today with you. So just to provide a little bit of background about what coronavirus is.
Publicly, the WHO had been sticking to the official Chinese line that there was no clear evidence of human-to-human transmission. But in front of the media, the agency's coronavirus expert appeared to contradict that.
So far with the current virus, we have limited human-to-human transmission, but what we are preparing for is the possibility that there could be. That was my first press conference I've ever done. I presented the situation as I understood it and as we understood it from the data and as it relates to the guidance that we want to put out. And so when you have a respiratory pathogen, of course there would be human-to-human transmission. It's just where is that happening and what is the extent?
News that the WHO had confirmed human-to-human transmission spread fast.
The first report came out from Reuters. They sent out a news alert that the WHO said that there was limited human-to-human transmission. So I quickly sent an email to Geneva saying, can you confirm this? And started writing the story, that the WHO had identified this as a virus that can spread easily among humans. And then they said, they sent me an email and to say, it was a misunderstanding. The preliminary investigations conducted by the authorities have found no clear evidence of human-to-human transmission. There has been no evidence of limited human-to-human transmission.
The WHO told us it could not confirm human-to-human transmission because it was not on the ground in Wuhan.
We rely on the information that is provided to us. There's always more information that we need, always. Things were happening very, very quickly, and we were utilizing the information that we have, and we always go back to the countries to gather more information, and China was no different.
I do appreciate that it's, early on in the pandemic, and there was this, there's what we call the fog of war. People are trying to understand what's happening, and you don't want to put out information before you don't really know what's happening. But it made a lot of us think, me included, that, this wasn't such a big deal after all. So I just left it at that and scrapped the story.
Outbreaks had now begun in other parts of China. People were turning up in hospitals in the major cities of Beijing, Shanghai, and Shenzhen. It was a week until Chinese New Year, and the country was on the move.
What typically happens is that in the run-up to the Chinese New Year, close to 300 million migrant workers leave the cities where they worked to return to their hometowns to celebrate the Lunar New Year with their parents and loved ones.
The Chinese government was already preparing for a possible pandemic, but it did not order a lockdown or any travel restrictions.
We don't know why there was this delay. So I think the Chinese government was coming up with a plan of how to deal with the pandemic. My favorite speculation, I guess, is that it made the decisions to hide the news so that the Spring Festival migration can proceed without any hiccups, without any panics. If they had announced a lockdown, that would have meant that hundreds of millions of migrant workers would have been trapped in the major cities, which would have great implications for both public health but also for stability.
In Wuhan, life continued as normal. There was a college careers event, performances, and a New Year banquet attended by thousands.
It was unnecessary. The Wuhan government could have canceled the banquet. Reporters talked to community workers, and they were afraid. And they tried to convince district-level officials to cancel the banquet, but the district-level officials would not do it. They refused to do it. My guess is that the order to not do anything unusual came from the very top, some very senior level officials in Beijing.
On the 19th of January, 5 days after the pandemic instructions, the head of the Wuhan CDC was still reassuring the public.
我们已知患者的临床表现呢，一般以轻症为主。我们可以初步印象，那么此次新型冠状病毒的传染力不强，疫情可防可控。
Across China, around 100,000 people were now likely infected, according to subsequent studies. On January the 20th, 7 weeks after the first case, Beijing finally confirmed that the virus was transmitting from human to human. The news was delivered on national television by a revered 83-year-old doctor, Zhong Nanshan.
针对人传人，现在的这个判断是什么样的？
过去曾经是有风险或者是什么，现在是目前的这个资料表示呢，它是肯定的有人传人，所以呢，这个现在可以这么说，是肯定的有人传人的现象。
Zhong Nanshan is very respected. To have him go on CCTV to disclose this, to be the first person in China to say that this is what was going on, was jaw-dropping. And that was when cases started to skyrocket in Wuhan, and the numbers multiplied tenfold very fast.
本台消息，近期湖北省武汉市等多个地区发生新型冠状病毒感染的肺炎疫情。截至1月20号18时，境内累计报告新型冠状病毒感染的肺炎病例224例，其中确诊病例217例，武汉市198例。
It was always going to be very difficult to control this virus from day one. But by the time we knew that it was transmissible human to human, I think the cat was out of the bag. It had already spread. That was the shot we had, and we lost it.
At 10 a.m. on the 23rd of January, Wuhan went into lockdown.
The city, at the heart of a public health crisis in China, is shutting its public transport network.
Flights cancelled, trains halted, highways blocked by police.
11 million residents have been told to stay put.
CDC Director George Gao told the public not to worry.
I'll be here, okay? Stay calm. We have the virus there. The virus is crazy. We do want to be crazy. Yeah. Calm down. That's right. 大家不要着急，是吧？病毒已经变得非常疯狂了。
大家喜欢和 SARS 比，一方面，这个病呢，确实现在看来，它和 SARS 比呢，它没有 SARS 那么强，出现了好多轻症。
But COVID-19 was much more transmissible than SARS. Wuhan's hospitals were overwhelmed. The Central Hospital received over 1,500 patients on a single day.
There were some patients who didn't need to die. There was nothing we could do. The medical resources were just too tight. It erupted too fast, and then there were just too many people infected. Without ventilators, without specific drugs, even without enough manpower, how were we going to save people? If you are unarmed on the battlefield, how can you kill the enemy? I believe that the true history needs to be remembered. We need to learn the lessons so that this doesn't happen again.
Zhang Hai's father was in hospital, recovering from his leg operation, but he'd developed a fever.
是阳性，当时我一听阳性，那就是确诊了，就是新冠病毒性肺炎嘛。当时我的心都一凉。那个时候我父亲，他人就是已经陷于昏迷状态了。医生当时就给我建议啊，所以说可以取下那个呼气机，但是我并没有同意。因为怎么说，我并不死心，我总是希望奇迹可以发生吧。所以说我当时一直守在我父亲的那个床，就是病床前。2月1号的时候，上午的时候啊，我就开车出去了，就是到处找人嘛，去买那个兽医。医院就跟我打电话， 就说让我赶紧到医院去。过了一会儿，几个医生就出来跟我宣布，说我父亲死亡了。是我自己，简直就是把父亲送回来送死的，所以说我有一种特别内疚的感觉，同时还有一种特别愤怒的感觉。普通的老百姓对政府，他们是一般怎么说？一般都是相信政府的，相信政府的。所以说，既然政府的电视里面都这么说了啊，可防可控，专家也说不存在人传人，所以说很多普通老百姓就相信政府。如果武汉市地方政府他不瞒报的话，我父亲他不会离开我，因为他的瞒报，所以导致这广大的很多人丢掉了宝贵的生命。
January 20th is the dividing line. Before that, the Chinese could have done much better. After that, the rest of the world should be really on high alert and do much better.
I don't think it's clear right now exactly how history is going to view this pandemic. It might have been a case where it was already too late by the time we realized that this virus was spreading. But I think what we can say based on what we know right now, it's clear that there were mistakes that were made, there were clear delays, and many people did suffer the consequences.
If the great coronavirus pandemic of 2020 teaches us anything, it teaches us that we absolutely have to have the kind of, open sharing among scientists and governments about all information. We're all in it together.
What we need is early warning and work together, share information, transparency. Now, all of these need a cultural change and need the political landscape to change. And unfortunately, right now, we're going the opposite direction. I mean, COVID-19 is not going to be the last one, right? Everybody knows that.
Two ordinary men spent 10 years inside the world's most secretive dictatorship. The mole infiltrating North Korea is streaming now on BBC iPlayer.